Folks, welcome back to another episode of the I Am GPH podcast. And we have another double interview. And actually, we have undergrads with us. We have seniors that are graduating this semester, which is unusual for me as a host. So I'm very, very excited. You know what's very interesting? This podcast, we think public health is global. It has global impacts. But have we ever thought about just the random stores in our streets? Have we ever thought about the things that we see every day but we don't even notice? These two amazing students have worked on a project with nail salons and how the impact of nail salons doesn't only impact health, but immigration, status in the city, where does it go beyond income and finances and how that's impacted. And this goes far beyond what one might think public health is. So I'm very, very excited to have two dual majors with us today. We have Brooke Rezvani and Annabelle Swigert. Welcome to the IMGPH podcast.
Thank you.
Glad to have the two of you here. And if I start introducing both of you, we would have gone on forever. So I'd love to leave it with the two of you. We can kick it off with you, Brooke. Mm-hmm. Please introduce yourself, your public health journey, what brings you here.
Yeah, so I'm Brooke. I am a major in global public health and applied psychology. And I initially got interested in public health because I came into college wanting to go into medicine, and I thought it was very important for any healthcare provider to have knowledge of the healthcare systems that they're interacting with on a daily basis and the issues that come with that are not always seen at first, so like accessibility and things like that. And as I got further into my public health classes, I got more interested on the prevention side rather than just treatment. So yeah, I'm super excited.
Glad to have you here.
Yeah, girl. I'm Annabelle, and I'm also a dual major in global public health and global liberal studies. I got my start in public health a little bit earlier in high school. I started working on the Teen Council for Planned Parenthood in Minnesota, and there I taught sexual education and did various advocacy work for comprehensive sex education bills in Minneapolis. And that's where I realized that public health was a field that I could pursue a career in. So I entered NYU in the liberal studies core program, transferred into global liberal studies and global public health, and that's brought me here today.
Very, very different backgrounds, but with
yes.
similar. I have to hear from the two of you of it's your last semester. I mean, we're shooting this in April, so 1 month till you officially graduated and going on to your own paths. What was the experience at NYU like so far? How has it influenced your direction? How you think right now? Tell us all about your public health experience.
I think it's been great. I think public health has been very instrumental in kind of furthering my skill set to be able to work in different fields in public health. So throughout my time here, I've had 3 internships. The first one was with March of Dimes, which is a nonprofit to support the health of mothers and babies. And I've worked in the advocacy side of that as well as the research side. And then I worked at the Crohn's and Colitis Foundation, which is also a nonprofit for individuals with IBD or IBS, so irritable bowel disease or irritable bowel syndrome. And then I also worked at NYU Langone on a pediatric research team, which was on interventions for low literacy rates in kids under 3 in low-income families. So I'm very lucky to have been able to do a bunch of different kind of realms of public health in my internships, and I've really enjoyed all of them so far.
It's been all-encompassing for you in a way. You've gone into different directions. Did every year change that path for you? How did you end up in these areas?
I started working with the March of Dimes my sophomore year, actually, and I was working more on the advocacy side. And then I went abroad to London, where I was able to go to their research center at Imperial College. And there I was involved in kind of a clinical transitional trial, if you will, where I worked in the lab, and we're working on an intervention on the vaginal microbiome and its impacts on prematurity and low birth weight, which I'm still working with them now. The other 2 were summer internships and semester-long internships. So,
what has it been like being at the school so far?
I think it's been great. I think you get exposed to very diverse perspectives, which is great, and you're able to take a lot of classes that you wouldn't even consider as being part of public health. Like I took a class called The Ethics of Reproduction, which is actually a philosophy class departmentally, but it was very instrumental in my passion for like maternal-fetal health, and I was able to learn a lot about issues that I'd never previously considered to be even relevant to public health.
Look at how that mind expanded and went into a new direction. direction. It seems similar to Annabelle, to how your journey actually started, the direction Brooke went in. I'd love to hear about how your journey changed and what the NYU experience was like so far.
The NYU School of Public Health is a really special place because you're able to take classes as an undergraduate, like Brooke was saying, that almost feel specialized like you're in a graduate course. So we take epidemiology and biostatistics and bioethics, and the professors are all extremely qualified and have very interesting backgrounds in public health, which as a student is wonderful to learn about when you're, freshman, sophomore, junior, because you get a sense of what direction do I want my career to go in public health. You can see all these avenues that different professors have gone down. So NYU Public Health has really allowed me to take a stab at different areas of where my career could go. So I worked for a health tech startup my sophomore year called Lucina Analytics, and they were working to, on the maternal side, reduce maternal mortality rates in the United States, which was really fascinating. I was on the research end of that and doing some data analytics. And then when I studied abroad my junior year in Paris, I was a part of an internship program that was possible through my other degree of global liberal studies, and I worked for a health consortium co-funded by the European Union called EIT Health, where I also participate in research from a more global perspective. So looking at the One Health method developed by the World Health Organization. And that was wonderful to give me a broader perspective of global health. And like we'll talk about today, there's so many issues just within the United States, within our local neighborhoods. But it's really important to have both that perspective and then also how the health system functions globally. So I really think that NYU GPH has just been able to give me all these opportunities and avenues to explore where I want my future career to go in public health.
You did local work and you have also done global work and studied abroad and actually put that into practice.
Yeah, absolutely.
There's just one thing I've never heard before on the show. It's about this One Health method that you mentioned. Can you explain more of that?
The World Health Organization obviously specializes in how we function as a global health population. How do we improve the health of the global population? So the One Health method looks at the different avenues that affects human health. So we have human health, we have animal health, we have our environment, and it's how do these different sectors affect each other? So for example, it's kind of a very simple way to explain it, but if we don't take care of our environment, that is going to have an impact on our human health and our global population. So we need to intervene in environmental health as well in order to improve the overall global population. And so it's a way to look at developing health policies and areas in which we can implement new health policies to ensure that we are ultimately working towards a healthier population globally. And it's wonderful to look at because it's a way that internationally, countries can kind of come to an agreement on, okay, if we have the ultimate goal of we want our entire global population to be healthy, how can we work together on improving these other sectors to ensure that we can work towards that goal?
I mean, that's probably decided a lot of your future path as well, that little experience.
Yes, absolutely.
Or that big experience.
Yes.
Let's say. How did the two of you connect? I mean, the two of you are on this episode right now. There was a project you all worked on, but I want to know, how did this even come to life?
We were in the same class. We were in our, what was our class?
Environmental health.
Environmental
Yes.
health policy. And so we were all in the same class and we were doing a project and we each got to choose a different lens. So my lens was epidemiology and Annabelle's was policy. And then we also had an environmental health scientist. We had a social scientist and we also had an economist in our project. And so we all came together to look at kind of our issue, which was worker health in nail salons, from different lenses. So that was very helpful to us in kind of creating a comprehensive look at the issue.
So you all took a class together and then got paired because of your different skill sets in that class?
Yes, it was a random pairing, and when we signed up for the project, we picked, what role we wanted to play. And Brooke is obviously, based on her background and what she's doing in the future, is very interested in epidemiology. I look more at health policy, and the project really showed how you take these different areas and how you work together, again, to create a better global future. So it was really important for our project. We needed someone to focus on policy research. We needed someone to focus on epidemiology, the economy, environmental factors. But yeah, we met in the class, and it's funny we haven't met before because NYU GPH it's not that large of a program, especially as an undergraduate. But I think we got along really well, and we were both very passionate.
Yes.
So it was a great partnership.
How did the project come to life? How did you even choose this direction, nail salons? How does one even think of that?
I can't remember which one of us came up with it. It might have been you, Brooke. Right?
I don't remember.
It was one of us in the group came up with the idea for nail salons, and we were just tasked with an occupational hazard issue. So huge range. It could be international. It could be in the United States. So one of our group members came up with the idea of nail salon workers, and it's a really interesting topic to do because, as you mentioned at the beginning, addressing these local issues is really important for all of us, and it shows how the vast areas you can go in terms of research. So this one topic of occupational hazards within nail salons, it was a lot of research. We've discovered a lot of things, but we also realized there's work being done on this issue as well. So for me, at least, it was really eye-opening because I didn't know anything about the subject before. So it was really interesting just to learn something new as well.
Was it a similar experience for you or how you picked this path?
I think honestly, like, we love to get our nails done, both of us. And so when you walk into a nail salon, you're hit with like that smell of like the monomers or the acrylic base or things like that. And it's very interesting because a lot of the times the workers aren't wearing masks. And so it's kind of interesting to think about like they're exposed to these things from 8 to 10 hours a day. And if I'm noticing it for the 1 hour that I'm in the nail salon, it obviously has potential to have very detrimental health impacts for those workers. So we kind of just wanted to explore that, and I'm really glad we did.
So tell me, how does this process even begin? You find a topic. How does a research process begin? How does analysis begin? All of you have different roles in this group. Tell me all about this.
We started off with our own particular section. So obviously we started with kind of one source. We all read about the issue, got a broad sense of it. And then, for example, Brooke did research on the epidemiological side. So what are the health impacts? You can talk more about this, but what are the health impacts of being exposed to these harmful chemicals? Whereas I was doing health policy research. So I looked at, okay, what FDCA, Food and Drug and Cosmetic Administration regulations are in place already that address occupational hazards. And then that stemmed into, okay, where are those regulations falling short? And then I came up with some recommendations for, okay, where's the point of intervention within health policy that we can address that would, enhance these regulations that are already existing.
I think for me, it was a very overarching thing at first because obviously in epidemiology, you're looking at what are the immediate health impacts. And so immediately we found it's negative exposures to VOCs, which are volatile organic compounds. So that's what they use to remove nail polish. So acetone is a VOC, and that's the most common nail polish removal agent. Exposure to that can cause nasal irritation, and it can cause headaches, and it can cause, kind of short-term cold-like symptoms. But as we got further into that, we found it can actually cause tumors, throat, thyroid, nose tumors. And we found that it probably may have a link to miscarriage, which is very sad. And it's something that you wouldn't think of immediately. I think the immediate health impacts like nasal irritation or headache comes to mind first, but I don't think a lot of people would immediately link miscarriage to being a nail salon worker. So that was really interesting for me as well.
It also connected to the work you did earlier on,
yeah,
right?
Yeah.
In pregnancies
Yes.
and understanding that.
Mm-hmm.
So it felt like you were well equipped for this world and to understand that side of things.
Mm-hmm.
Did y'all have any assumptions going in that, this is just going to be a small project? And what surprised you is also what I'm interested in, because I read the work y'all did, and some of it was fascinating and frankly unexpected to my mind. So what assumptions did the two of you have? How did that change over time?
Like I said, I think we all were on the same page that exposure to VOCs would have negative health impacts on the workers, especially at such long periods of time, and they can be in that field for obviously 30, 40 years. But I think, at least for me, one thing that I was shocked to see is that as we're going through these studies, we're looking to see the impacts, and we're looking to see the people that are involved in the studies, what did they individually experience? And we ran into a pretty significant limitation in that a lot of the people that have had these worse exposures to VOCs, and they have developed maybe a tumor or they've developed a chronic condition as a result of it, have left the field either voluntarily or involuntarily. And so all of the studies we found didn't have a population that was necessarily representative of all of the workers who are working in nail salons, just because of the fact that they aren't able to continue that work, right, for long periods of time.
Yeah, it's really interesting. And this is I think what surprised me most, and this is exemplified through what Brooke was explaining, is the complexity to the issue. And even just within the policy portion that I was doing research on, I didn't realize the layers that go into developing health policy. So I found myself sifting through safety data sheets and learning that there actually are regulations in place. So for example, nail salons are required to have on display their safety data sheets for their employees. But then you realize, okay, these data sheets are only mandated to be published in English, and a majority of the population of nail salon workers, English isn't their primary language. And so then you think, okay, how do we ensure that these data sheets are available to read for all workers? And the other complication is, okay, if we have these enforcement methods, what if there's a shortage of local enforcement, or what if there's not an interest in enforcing these regulations? So you realize that it's not enough to just create the policy to say, okay, this is a regulation, you have to do this, or else. It's kind of like, okay, what is the or else? And how can you as a policymaker help to ensure that these other areas are smoothed out so that not only is your policy in publication, but that it's actually making a difference and having an impact on the ground level?
What were the recommendations at the end of the project that y'all gave to your professor and even to other nail salons out there?
My recommendation, I looked at kind of the different stakeholders that are a part of the issue. So you have the enforcement aspect. So working on if there is a shortage of local enforcement, okay, that's an issue where you have to intervene. How do we improve the, enforcement agency, I suppose, or improve the way in which we enforce these regulations? Another area was specifying within the FDCA regulations on occupational hazards, although they exist, how do we specifically address the chemicals that are used within nail salons? So creating more specific regulations within those that are already there. And another interesting aspect was how the private sector is kind of developing technology to work on this issue. So we looked at technology that was developed that's a digital module that's accessible internationally that teaches nail salon employees how to utilize these chemicals safely. So that was a very interesting piece to see that there are people working, especially in our age of AI and technology, that are working to digitalize these safety data sheets and create an easier method that is translatable for these employees. So it was kind of attacking translation, enforcement areas, and specifying the regulations.
Giving some background to that, we found that over 80% of nail salon workers are Chinese, Vietnamese, or from other Asian countries. And so that was very important, is they're able to understand what they're doing and how it can impact their health, especially if they have the choice to wear masks or not. And then also just addressing it at the root cause. So even if we do have these safety data sheets available to them, and we do have, we secure the funds to provide sufficient PPEs and ventilation and everything like that, then it becomes the issue of, well, these people are working, I think for an average we found of in the $30,000 range. And so do they have enough transportation to get to a nail salon that does have the funds to provide these for them? And can they actually, secure the time that they need to go and purchase their own PPEs if that's necessary, and things like that as well?
I think just adding on kind of to what Brooke said, this project is an example of how the field of public health goes far beyond just, the health impacts of someone, but you have to have a combination of policymakers, economists, environmental scientists, epidemiologists, and you have to combine these fields to work together because the issue is clearly not just one of a health hazard. There's all these other mechanisms within that have to do with local governments and things like that you need to work together. And it shows how the field of public health, it's really important that we can get these different factors and these different areas of people working together to solve these issues.
This is fascinating. I mean, it's a lot of work, and it's really concisely put in terms of the work the two of you have done. I'm interested in knowing how this project has influenced your future of how you view public health after graduation. How has this impacted the way you think? What are you taking from this project as you fly out into the world of public health yourselves?
I think for me, as Annabelle mentioned, it's a very nuanced field with a lot of different layers and a lot of interconnections. I think it's really important that we see how health inequities can be deeply impacted by the systems people move through on a day-to-day basis, even without realizing it. So for example, we can have an intervention and we can have the funds for it. We can provide like a bus voucher for people to be able to get to the intervention and participate in the study. But are they in an area where there is sufficient public transportation for them to get to it? Can they secure childcare if they have other kids and the kids can't come to the study, right? Can they get the time off work to do that as well? So it's a very interdimensional thing, and there's for sure a lot of work to do. But I think as for me, like I plan to work in the maternal-fetal public health field after graduation. And so I think that's something that I'll definitely carry forward with me, is trying to look at the whole picture rather than just this is the issue that we're facing. What Band-Aid can we slap on it to make it better for now?
You found a deep passion in the maternal side of things and you want to fix it at the root of the issue.
Yes, exactly.
Beautiful. What about you, Annabelle?
This project was very important for me to work on in regards of understanding health policy, and there's a lot more research that I need to do on how policy works within the United States regarding health and healthcare. But this encouraged me to pursue a graduate degree starting in the fall of 2026 at Sciences Po, which is a French university, and in global health policy. And so this really encouraged me to understand not just policy within the United States, but how do we work together. As I mentioned, it's really important that there's cooperation across all fields in order to improve the health of a population. And so I think pursuing a degree internationally is extremely important in kind of putting that on a broader scale. And how can we work together and cooperate as different nations to create a better global population, global healthy population?
It's almost like local issues fix global issues as well. Learnings from local issues have impacts. And it also shows the work that you did internationally before is now coming to life, and that passion is getting unlocked for you.
Yeah, absolutely. And we can really learn, countries can learn from each other. And like I mentioned, I got my start in Planned Parenthood, which is very local to where I'm from in Minneapolis and in the United States. And I think it's important that I worked in France. I can learn things from how France works on health, and they can learn things on how the United States works on health. So once again, it's just great, I think. And one thing that global public health at NYU has taught me is how do we learn from each other in different nations, different organizations, again, just to have that broader goal of a healthy population.
For the students that are undergrads that are joining right now, it's their first year or the second year, from the two of you, what are some hidden gems here at GPH that people might not know about or you'd like to share as you leave?
I would say really dive deeply into what you can take in GPH. I mentioned a class I took in the philosophy department that I was able to count as a GPH major elective, and that is one of my favorite classes I've ever taken. It's called Ethics of Reproduction. But I think really understanding what is the field of public health and what are all the branches of it, because as you dive into that, you can discover these different, more specialized courses that you're able to take, and that can kind of ignite your passion for a certain field or expand your knowledge in a way that you hadn't considered previously.
Yeah, absolutely. I agree with Brooke. There's so many course options within NYU GPH that are so interesting, and we're so lucky to have as undergraduates because it's not a very common undergraduate major to be global public health. So I think taking advantage of those, and they set you up really well if you do want to pursue some kind of higher education, whether it's master's in public health or health policy or whatever it may be. You have such a solid foundation. So we've done epidemiology, I've done biostatistics that sets up the space for pursuing that at a higher level once you graduate. So it's almost like a kickstart into whatever higher education, if you choose to pursue. But I think one thing, like a little thing for NYU undergraduate public health students, is the GPH building is beautiful. It's a great study spot. I loved coming to study here. You feel like you're a part of a kind of a special community. So I would definitely recommend taking that as kind of your little safe space to do your work. And I really enjoyed that over the course of my time at NYU.
The hidden gem is the gem alone.
Hidden gem is the building, yep.
It's almost like expand your experience beyond where you are. You'd be surprised at how interconnected the school is and the kind of programs y'all can take. And when you have to study for them, come to the building to study.
Exactly.
Yeah, for sure. And I think we also both noticed we happen to both be in GPH, but I've also taken classes with kids from Stern and from Tandon in the engineering or business schools, or maybe they're in real estate. So I think it's really interesting how interdisciplinary our classes can really be. And I think it's very important to, speak to people in your classes and see why they're taking the class and how it can tie into their career path as well.
One final question for the two of you. As you'll go out now into the world, what is a lesson that you're taking from NYU that I know you shared some gems, some thoughts, but what's like a lesson that sticks with you from your time at the program that you'll take out into the next stage of your journey?
I think for me, I would say this is kind of a broader theme, but try and say yes to everything, even if it's out of your comfort zone. I was able to study abroad and do different internships and do this podcast, all of things which I didn't see myself doing when I came into NYU. When I initially came in, I was very dead set pre-med, this is what I'm doing. And I've now completely changed, not completely, but I've changed my path a little bit based on my experiences. And I wouldn't have been able to do that had I not kind of expanded my view on things and done things I'm a little bit uncomfortable with.
Yeah, absolutely. I think the biggest lesson I've learned is, especially in public health, is as you enter your career, you can maintain your moral compass and you can have personal ethical values and utilize those to further your career. And that's something that sometimes gets lost as you get older and you realize, okay, I need to support myself, I need to make money. But I found in public health, I was able through this program to maintain my personal values, what I believe in public health, having that priority of making a healthier population and still pursue and find career avenues that will allow me to support myself. So I think it's important for undergraduates to know that you don't have to push your passions or your ethics out the window because that's what you're told or that's what you think you have to do to find a great and successful career, because you can absolutely find a successful career that you're passionate about, that your ethics align with. And I'm so thankful that NYU GPH and Global Liberal Studies has allowed me to see that and to pursue those avenues.
The program has instilled a beautiful value in the two of you.
Yes.
Thank you.
Well, thanks for sharing these amazing insights. And it's such an inspiring project that started locally but is now having global impacts for the two of you. The both of you have reach abroad right now as well, where this is going as the journey continues. It was truly a joy having the two of you on the episode.
Thank you so
very
much.
much.
So
Thank you
nice
for
to meet
having
you.
us.
We're very grateful to be able to do what we do.
Yes. Thank you.
Everybody, that's Brooke and Annabelle. Stay tuned for what's coming next and find out what's a local problem that can have global solutions in your public health journey, because there's so much out there for integrity and getting out of your comfort zone. Take care, everyone. We'll see you in the next one.